Hello. In this episode, we will discuss how to reduce severe pain in the lumbar spine and improve its function, especially in elderly patients or patients with advanced stages of osteoarthritis. Let's go. In the first video on treating osteoarthritis, we discussed the initial manifestations of osteoarthritis, which is most common in strong and young patients. And in the comments, I received a lot of feedback that these exercises are difficult for people with higher degrees of osteoarthritis or intense pain syndrome. Today, we will go through exercises that are simpler to perform but no less effective. And at the end of the video, my patient will demonstrate to you that these exercises can be performed in any age category. Before performing these exercises, it's important to know that very often pain in the sacroiliac joint area is associated with the lumbar spine. And before performing the exercise, I suggest doing a little testing. When the pain originates from the lumbar spine, the bending of the sacroiliac joint is primarily disrupted. That is, it's painful to pull the leg towards yourself in this area. At the same time, the external rotation of the thigh and the internal rotation of the thigh are practically identical to the healthy leg. When it comes to coxarthrosis, that is, the problem is directly in the joint itself, then the volume of the internal rotation of the thigh will decrease first and foremost. That is, this movement, when we turn the foot outward, the thigh rotates inward. Firstly, this movement becomes limited. Secondly, the bending of the hip joint will be limited. And only thirdly, the external rotation of the thigh. Therefore, if your main limitation is in bending and the rotations are quite free, then you need to do a set of exercises aimed at the lumbar spine and sacroiliac joint from our video about working with the sciatic nerve. If after performing a set of exercises for the lumbar spine and sacroiliac joint your bending improves, then the problem is not in the hip joint. Continue doing exercises from these videos. If the pain mainly occurs during internal rotation and lifting and does not respond to lumbar exercises, then there is a very high probability that the exercises from our complex will help you. All exercises should be performed without pain and at a comfortable amplitude for you. If you feel discomfort or pain in any of the exercises, skip it. The first exercise, the simplest warm-up, preparing for the rest, can be done right on the bed if it's hard for you to get down on the floor and get up again. The exercise will be demonstrated for the right foot and do the following. Start moving your toe without lifting it from the bed towards yourself. First, move it forward and backward a few times to a comfortable level for you, then lift it after 3 to 4 movements. During the movement of the knee upwards, try to maximally bend the knee inward, but without experiencing pain. And the movement of the knee upwards goes with the shift of the kneecap towards the center of the body. Then straighten the knee and lower the patient along the central line. Again, pull the kneecap inward, look straight and lower along the central line. Repeat this movement 15 to 20 times. Then pull the toe towards yourself, but at the same time maximally open the thigh. Return again through the even position. Again, pull the open thigh. Return through the even position. Do this exercise also 15 to 20 movements. Usually, after this exercise, the joint warms up a little. It gets warmer and the sensations in it improve. You can perform it in the morning as an independent exercise in the form of a warm-up and as the first exercise from our complex. For the next exercise, we will need a tennis ball. With its help, we will massage the muscles of the gluteal area, which are actively tensed with coxarthrosis. To do this, place the ball in the projection of the middle gluteal muscle. Press against the wall. If you're comfortable, you can also place your hand on the wall. Don't move too far from the wall. One foot should be a support for control. Try not to put too much weight on it. try to put more weight on this foot. By shifting the weight to the right foot, we will increase the pressure from the left ball to the muscles. In this way, I strengthen my leg. Because of this, I push myself to the wall on the ball. If you immediately hit a painful point, stay in it for 20-30 seconds until the pain goes away. If the point is not very painful, then you can make small searching movements with your feet in order for the ball to get into a more squeezed point. When finding a more squeezed point, again, give strength to this leg and press yourself slightly to the wall. During the stretching of trigger points in this area, you can often feel numbness going down the leg. This is a normal feeling. Don't be afraid of it. After we have stretched the area of the middle gluteal muscle, we move on to the area of the wide fascia of the thigh. He is right here already on his foot. Also, wrap the ball and repeat the procedure we use for the middle gluteal muscle. You can slightly search for a more painful point and press it with a healthy foot. After stretching the wide fascia of the thigh, we will stretch the area of the pear-shaped muscle. Place the ball approximately in the middle of the buttock, on the line from the coccyx to the crest, approximately here. The pear-shaped muscle is located very deep, therefore relax your leg as much as possible and slowly lean on the ball. Try to make it go into the muscles as deep as possible because the pain will be very deep. You can stay here for release and muscle relaxation for a minute. I do not recommend moving the ball strongly when it has gone deep into the muscles. This will be extremely painful and ineffective. Many patients with coxarthrosis also have an overstrained quadriceps. If we want to relax it, we can put a ball right in the middle of the thigh and perform the same procedures as with the gluteal muscles. We don't just passively press down, we slightly push ourselves directly onto the ball with our back leg. Then you can move the ball lower. Sometimes the tension strongly goes to the side surface of the thigh. It can also be rolled with the ball in the same way as the front surface of the thigh. At different levels, but do not reach the knee joint approximately 10 centimeters. You can roll straight along the sideline in 3 to 4 places. You also push with your foot. You can stabilize yourself with your hand on the wall. After relaxing these muscles, the joint will also feel more free and pleasant. Next, after these exercises, we will move on to soft mobilization techniques. That is, techniques that directly improve the mobility of the pedal itself. For the next exercise, we will need a rubber expander. If you don't have a rubber expander, you can use a regular belt. To have enough length, you can tightly fasten either 2 belts or use a long rope. It's very important if the rope is thin and sharp not to damage the skin and not to cut off the blood circulation. Place something soft between the belt and the skin, for example, a towel. Set the rubber as high as possible to the thigh, under 90 degrees to the sick leg. Secure it approximately at the level of the thigh and pull it tight enough to feel the stretch in the joint. Next, holding onto the wall, shift your weight onto the healthy leg and try to relax the area of the affected joint as if you are hanging on the rubber or the belt. At this moment, you will feel a stretch in the joint. Usually, it's a pleasant feeling. If you feel sharp pain or unpleasant sensations, do not perform this exercise. If you have a band, you can also slightly bounce on the band, which will intensify and reduce the stretch, thereby pumping the joint, improving the circulation of intra-articular fluid. Perform this exercise 50 to 70 repetitions if you have a band, or if you are doing a static stretch with a belt, you can do 3 approaches for 30 seconds each. If you feel that your leg is going numb, then you need to place a softer towel under the belt area. The next exercise is performed from the same position. Also, fix yourself with your hand behind the wall for greater stability. Pull the belt or rubber band, and leaving the sick leg as a support, start making small half steps forward and backward with the healthy leg. For the best stretch, we slightly fall towards the wall, holding ourselves with our hand. This is required for a better stretch in the sacroiliac joint area. It's very important in this exercise to slightly shift your weight onto the healthy leg at the end of the step. Do about 30 to 40 steps like this. Those who can perform a more advanced exercise, you can do a modification of this exercise. After 30 to 40 steps, you can make a small circular step. That is, we leave the sick leg as a support, it does not move, and we make a small turn with the healthy leg around the sick one, and a small turn back, a small turn forward, a small turn back. Each time, shift your weight to the healthy leg at the end of the step. Also, from this same position, you can perform small squats. You don't need to go deep. It's important just to have movement in the joint against the background of stretching. For the next exercise, we will need a belt and some kind of support. Now I will use a chair, but it is most convenient to use a door jamb. To perform it, lie on your back. Place part of the belt with a soft pad on the thigh of the affected leg, and lean your leg against the door jamb or some piece of furniture. Put the belt on the other leg in such a way that the knee is slightly bent. Next, the leg is positioned neither low nor high. Try to pull the belt in such a way that it goes under the thigh at a 90-degree angle. The belt is positioned as close as possible to the hip area. If you find it difficult to bend your thighs so much, you can slide a little further from the support, but then you will need to slightly change the belt vector and press down a bit in order to maintain a 90-degree angle between the belt and the thigh. If you can bend your thigh to 90 degrees, then your leg will be pushing not down but forward. Now push your leg forward so that the belt starts to mobilize, moving the femur down. Make strong but at the same time smooth pressures on the belt with your healthy leg. The leg is positioned in such a way to be immediately behind the sick leg. That is, we do not divert to the side. We slightly, on the contrary, bring it to the middle of the body so that the belt is exactly at 90 degrees and straightly mobilizes the thigh. It's very important in this technique to relax the leg, not to resist this movement. If the movement is painful for you, then skip this exercise. In most cases, for people with coxarthrosis, it brings very quick and good relief. Make 30 such movements. If it is difficult for you to make such movements, then you can stretch the belt with a healthy leg and hold the stretch in the hip joint 3 times for 30 seconds. You can do these exercises every day. If you do them once a day, it's better to do them in the morning to ensure a good feeling in the joint all day. If you do it twice a day, you can do it in the morning and in the evening. Of course, this complex will not cure severe coxarthritis, but with its help, you can maintain the joint in good condition, improve its mobility and function, and significantly reduce pain. Most often, severe coxarthrosis leads to the replacement of the joint with an implant. If you have already had a joint replacement with an implant, then these exercises are contraindicated for you because they are aimed at improving the mobility of the joint, and there is no need to improve the mobility of the implant. What to do? If you have already had a joint implantation, we will talk in the next video with the rehabilitation specialist Maxim Nikitin, and now together with Tamara Andreevna, we will show you the performance of this complex. Good health to all. To be continued. To be continued. How do you like our exercise complex? Was it hard to do?
No, it wasn't hard.
It went well, didn't it?
Absolutely normal.
Excellent. Tell our viewers, how old are you now?
78 years old.
Excellent. So one can handle such a complex at any age, right?
Well, I can only answer for myself so far.
Thank you very much for helping me.